Is Carter Physiotherapy in network? I'll take this one. Most of our patients have health insurance, and most of our patients decide to submit what are called self-claims to get reimbursement for the work here. But what we were talking about earlier with the cash-based thing is that in order to not have our treatment dictated and influenced by insurance companies who are evil, we've decided to not be in network with those companies so that we can spend an hour one-on-one, not having to employ PTAs or techs to do the care, right? So we get to have one-on-one time, hands-on care, full-hour sessions by not being in network with insurances. But most of our patients do submit claims to get some sort of reimbursement or application to deductibles when they come see us. And just one more additional thought on that. Since, I guess, 2015, when the Affordable Care Act started to kind of have an effect on things, it seems like most deductibles have skyrocketed.
Absolutely.
And not just that, but PT benefits and copays have gotten worse. So before, maybe a copay was $20 or $25. Now it's not uncommon for you to go somewhere that takes your insurance and you spend $75 or $50 as a copay, and you hang out with a tech and 5 other patients in this gym, you know, pulling on stretch cords. Whereas when you come here and you're looking at 150 to 165, sometimes it varies depending on the time frames, but you're going to only see us probably 1 time a week where you're doing that other thing 3 times a week. It actually has ended up where we've become cheaper, even though we don't take your insurance, for a lot of people who have a high deductible. They have to meet the deductible or the high copay. So the take-home point being, just because a medical practice doesn't take your insurance, or not in network, it's important to check and see, well, what am I going to have to pay at this other clinic where they take my insurance before I hit my deductible? You might find you're paying $200 or more a visit for that care versus really high-quality care and less upfront pay. So make sure you know your benefits and what exactly you're going to be paying out of pocket if you want to stay in network versus going out of network for PT.
And also, like that is your right to choose as a patient where you want to go to physical therapy. So people are allowed to go to PT if they want, even if your doctor may send you somewhere else. If you decide that this is the best fit for you, you have the right to do that. So we're always encouraging our patients, if you think this is a good fit, just because your doctor wants to send you somewhere doesn't mean you have to go there. It means you can choose to go there, that's fine, but if you want to come here, you have the right to do that.
Yeah.
So
You have the right to choose where you get physical therapy.
absolutely.
Good point. All right.